hold it down for a second. Thank you.
Good afternoon, everybody. Well, here we are in the second half of the legislative session. We always look forward to the bill deadline when bills transition from the House to the House to the Senate and vice versa, because you know there's now a light at the end of the tunnel. Well, as the week progressed, we found out that the light that was at the end of the tunnel was not sunlight, but it was in fact a train, with various circumstances happening from the executive branch. And so today, pleased to be joined by some of my colleagues in the House Republican Caucus. There's many, but in particular I wanted to ask, in light of some of the governor's comments about the Forestry Service and fire service in general, that we have some of our members who are current or former firefighters to join me. And following my introductory remarks, Chairman Stan May will have some comments as well about the fire service. And then in light of the situation with the Department of Mental Health, I thought it was very appropriate to invite our Public Health Chair, Representative Cindy Rowe, to talk about mental health a little bit. And so here we are in April of the session, and we're trying to build a budget and go about the business of the people of the state of Oklahoma. And we keep hearing from agency after agency a lack of transparency in their needs, and coming to find out later after the fact, after cuts have already been made or contemplated or communicated to stakeholders before the legislature found out about it. And frankly, our state constitution is clear, just like our federal constitution, that the legislature has the purview of budgets in the state of Oklahoma as the Article 1 branch of government. This is not a new disagreement, unfortunately, over the past 7 years, but here we are again. And look, I do want to be the first to say we are all for finding waste and inefficiencies in state government. In fact, the Oklahoma House of Representatives was on the forefront of the DOJ conversation, being the first entity in state government to launch a DOJ portal last December, which all Oklahomans have been able to and continue to be able to submit suggestions for waste, inefficiencies, or duplicative government services. And you saw throughout our budget hearings that we conducted in January where we asked agencies some of those questions that we received from the public. And we're hearing about core services being cut in some areas, and some of these cuts, while they can potentially save money in the short run, they in the long run can cost the state more money. And one of the challenges we've been hearing for some time now of a directive to agency directors that they reduce FTE count. And you probably saw that if you read the DOJ report that OMES put out a couple of days ago. On the last page, it puts out a directive to have fewer FTEs in 2027 than there were in 2019. And that is a laudable goal, to shrink government and have fewer FTEs. But when you put in regulations as government, there are always consequences, both intended and unintended. And I have asked no less than 15 agency directors privately, and I know our appropriations chairman has asked several agency directors as well, are you spending more money because of your cap on FTEs? And every single agency director that I've asked has said, yes, we are spending more money because what's happening is, instead of hiring a state employee, we're going out and hiring a contract person to do the same job. And so they end up actually spending more taxpayer dollars to deliver the same services. There are many examples about that you can see in PR contracts and things of that nature, but I thought one of the most glaring examples, I asked that question to the Director of Mental Health earlier this week, and she cited an example of $200 per hour for contract nurses, whereas if the Department of Mental Health were to hire those nurses, it would be $65 an hour. And at the end of the day, I mean, for the nurses themselves, they're probably going to be happy being a state employee because they're going to still get good pay as a nurse while also having state benefits and not being on a contract. But somebody is taking a cut of those contract dollars, but it's not beneficial for the state of Oklahoma. So this week alone, we've heard from retroactive cuts for services already rendered. From the Department of Mental Health, again, we found out after the fact that they were revising contracts retroactively dating back to October 1st. And again, I want to repeat, these are services that these providers have already rendered. They have done a service in a contractual relationship with the state, and the state is later, 6 months later, saying, yes, you performed that work, but we're not going to pay you for it. I think that's, not only is that bad business for the state of Oklahoma, it's not good for the people of Oklahoma, and particularly the people that these providers serve, it's just frankly sets us up in a terrible position in any potential lawsuits. Other things that we've seen over at the Department of Mental Health, there's one area where I just believe it is an inefficiency. So the only agency that works directly with the Center for Medicaid Services is the Oklahoma Health Care Authority. Yet for some reason in statute, we have it set up where we appropriate funds to the Department of Mental Health and the Department of Human Services. And so what happens is the Center for Medicaid Services bills the Oklahoma Health Care Authority, OHCA pays the bill, and then they have to back bill the Department of Human Services, the Department of Mental Health, for a bill they've already paid, because they're the ones that actually have the contractual relationship with CMS. And so if we're looking at DOJ and inefficiencies, that right there is an inefficiency. We should appropriate the funds directly to the OHCA and not to the Department of Mental Health. One glaring example, I know $5 million may not seem like a lot of money in light of the $90 or $100 million that Department of Mental Health is also missing. But we found out that we appropriated to the Department of Mental Health in a line item $5 million for electronic health records. Those $5 million have vanished. They do not know where they went, but they certainly did not go to electronic medical records. Also, earlier this week, there was a call for the elimination of the State Forestry Department, and just want to say that is unacceptable. The Forestry Department is absolutely critical to fighting wildfires, wildfire prevention, and also management of our woodlands in the state of Oklahoma. 23% of the state of Oklahoma is covered by some form of woodland, and the Oklahoma Forestry Service is critical to that. And frankly, I'm hearing from firefighters in my district. I know all my colleagues around me are hearing from firefighters in their district. Who are frankly furious about what has happened and the insult not only to the Department of Forestry but also to the fire service in general. When disaster strikes, those folks, those firefighters, and again, some of my colleagues that are standing here behind me, they have done this. They're the ones who run into the burning building to save people who are in houses. They're the ones, when a tragic accident occurs on the side of the road, they're the ones who respond to help get people out of those situations, whether they're alive or not. And for the House of Representatives, we're going to stand with our firefighters and our fire service. Some of the things that we've done in the legislature that we're going to continue to call for, and we're calling for today again, is support to be prepared for the future. And some of those are House Bill 2162, the Terry Peach Watershed Restoration Act by Representative Dobrinsky, and House Bill 1728, the Salt Cedar Eradication Act by Pro Tem Moore. Both of those bills are incredibly important to reduce these cedars that are just a problem in the state of Oklahoma. And additionally, we lost a lot of cedars in the wildfires. I guess if you want to see some positive news from the wildfires that happened a couple of weeks ago. But it is up to the Oklahoma Forestry Service to make sure we manage those very lands that just experienced those fires so that cedars don't grow back in the same exact spot at double the rate that they were before. So the Forestry Service is essential to that. Another thing that we've experienced, I know my colleague to the left of me, Leader Josh West in Grove, he knows of 3 positions that are currently vacant in the Forestry Service just in his district. And so we want to talk about, again, that is a cost-saving measure in the short run to have those 3 vacancies in Jay, Oklahoma when it comes to the Forestry Service. But what does that do from a fiscal management standpoint in the long run? It means that we are less prepared for wildfires, which means more costs in the long run by having those positions unfilled in Jay and other locations across the state of Oklahoma. We need to fully fund, fully support, and fully staff the positions at the Oklahoma Forestry Service. Another agency, now there's been a lot of talk about forestry and the Department of Mental Health, but also want to talk about DHS. Right now they're looking at cuts to a senior feeding program. And this program costs $6 a day to provide a second meal to the most vulnerable senior adults, which 1 is the right thing to do, but 2, again, from a conservative fiscal management perspective, is the right thing to do. Because what happens if we cut this meal to the most vulnerable that, again, only costs $6 a day? We know approximately 25% of these individuals, because they all qualify for Medicaid, 25% of them are going to go to a nursing home, which means worse health outcomes for them because they're no longer living independently, getting to be on their own, and also substantially greater cost to the state of Oklahoma than the $6 a day we're currently paying for that meal program. So we've also looked at the DOGE report. Although we just received it for the first time this week, we haven't had a chance to go fully through it, but from what we see, we did not see any savings to state funds throughout the report, although it does purport to send some federal funds back. Although we have heard reports that we haven't had a chance to confirm it, because again, we just received this week, that perhaps some of the funds outlined in the DOGE report that came out from OMES were already going to be clawed back from the federal government anyway. So with that, we're committed to passing a balanced budget, funding vital core government services and being efficient with taxpayer dollars, and returning whatever is left to the taxpayers as we are able. We're going to continue to govern in the Oklahoma House of Representatives. We're going to continue to stand with the Forestry Service. We're going to continue to stand with the most vulnerable when it comes to mental health and the elderly. And with that, I'll yield to our caucus chairman, Representative May.
All right, thanks for having us out here today. Communities across Oklahoma rely on their fire departments every day. Sometimes it's more evident because, the news coverage of the big items, but whether they're rural or urban, paid, volunteer, all fire departments can only afford a finite amount of equipment and manpower, and to be able to keep that up adequately. And in order to combat those things that we're asked to do, we borrow from one another. We have agreements with almost every fire department in the state, and when we're asked, we go. Doesn't matter where you're from. And part of that is the State Forestry Service, because not many rural fire departments, much less the urban ones, can afford the bulldozers and the trucks and the backhoes and the things it takes to fight a forest fire or a wildland fire. And last week, we seen they had to respond to 140 fires with 130 personnel. So did they get to everything? No. But part of the Forest Service is that they are part of a larger organization. They belong to the U.S. Forestry Service. And during times like we had the last couple of weeks, other forestry departments from other states send their employees to us, because our big fire season is early spring. Theirs is more during the summer. And when they ask, we have to send ours to them. But it doesn't cost us anything. The federal government pays for when you go help another state. But without the State Forestry Service here, we could not cover and combat those wildfires. They move too fast, especially in volunteer areas. They don't have the manpower. They don't have the equipment. And quite frankly, it might bankrupt some communities if they didn't have that help. So they did a great job. Again, they're down at least 9 employees from a year or two ago, and they haven't filled those spots. But we had more fires than we had employees. So anything they didn't get to, well, that's kind of the system that we set up for them to fight. So that's all.
Thank you, Mr. Chairman.
Yep.
Next, I'm calling our Public Health Chair, Representative Cindy Rowe.
Thank you, Mr. Speaker. My name is Cindy Rowe. I'm chairman of the Public Health Committee. I also am a registered nurse for 42 years, and I'm currently a nurse practitioner, and I work in rural health care. I continue to work in my district as a nurse practitioner in a primary care setting, and I also work delivering emergency room services in one of my local hospitals. And I see every day the effects that some of the budget cuts coming from the feds as well as the state is going to have on our most vulnerable population. As Speaker mentioned a minute ago, talking about our elderly and the food programs that may be cut, we all know that proper nutrition plays an important part of health. And these individuals that may end up, with not enough food to eat, may end up in a long-term care facility where they're going to be more vulnerable to fractures and other declining health issues that are exacerbated by being displaced from their homes because of poor health reasons. As the federal government continues to make cuts through their DOGE program, the state may be responsible for picking up part of this funding to fund these agencies to continue to deliver the health care that we're already delivering. That's going to be very difficult to do when the agencies have been directed to have flat budgets. Health care costs are increasing astronomically, and it's very difficult to get healthcare services to some of our most vulnerable populations, especially in the rural parts of the states. Mental health is a whole nother issue totally unrelated to the physical health. We have mental health that cares for young children all the way through our elderly population. And not having enough mental health providers to be able to adequately assess and deliver the care and treatments these individuals need is going to have devastating effects. We're in a mental health crisis, we are in a substance abuse crisis, and a lot of these facilities deliver care for both of those situations. So I'm very concerned that, especially in the mental health department, where we've got some funding that we're not sure where it has gone, and trying to keep up to deliver the services that we need, we're in a crisis. So I'm very disappointed that we may not have the funding because of the flat agency request, that we're able to provide the services that our Oklahomans need.
Thank you. Thank you, Madam Chair. Open to questions.
This goes into funding volunteer firefighters. Last year, I think the governor vetoed SB 453. Do you remember that at all? It was a volunteer firefighter pension multiplier, basically. It would have recruited and retained more.
Go ahead.
Do you know about that?
Representative Kelly.
He vetoed that last year.
Yes, sir.
I don't think y'all overrode the veto on that. You did the police one, but not on that one. Should we have overridden that veto? Should we put more funding to volunteer firefighters?
That's a great question, and that became a timing issue when that was vetoed. The legislature had already adjourned, so there wasn't an opportunity to come back and override that veto. What that bill would have done is raise the multiplier, which is a dollar amount per year of service for our volunteer firefighters. It's about $7.56 currently. It would have raised it to $10. So for someone that served 20 years, it would have raised it from essentially $156 a month to $200 a month. So great question.
So it would have helped. Do we need something more like that going in the next year, or what's the?
That is a discussion. That bill was actually a bill similar to that was introduced this year in the Senate. Any pension bill is a 2-year. It's got to go to an actuarial study. So that bill is going to an actuarial study, and it will be up for us to reconsider again in 26.
Thank you, Representative Kelly.
You bet.
I did warn the folks. I said, hey, if you stand behind me in the press conference, I might call on you as it comes. So good on the freshman for being ready. Thank you, Representative Kelly.
Do you think that all of these concerns that you've laid out, do they make it less likely that the legislature as a whole, and House in particular, might support this income tax cut this year?
So that's the interesting thing about it, is it's being framed as an either or, and nobody in the legislature, to my knowledge, has ever framed it as such. Look, we have critical needs facing our state government, and what I've communicated to the executive is, look, we have to figure out our state budget first. We can't go in the first week of February and go cut revenues to the state of Oklahoma before we look and see what the needs are of the state. And it's a good thing that we took that posture, because a lot has happened since the first week of February that we didn't know about. We didn't know about this hole. And the interesting thing, we met for an hour and a half with the Department of Mental Health in the House 2 days ago in my conference room. And about an hour and 15 minutes into the meeting, I said, okay, so we're at a $23 million cut. And then someone else in the room said, no, 43. Someone else in the room said, no, 94. We were in this meeting, everybody was in the same meeting for an hour and 15 minutes, and we couldn't even agree what the cut was by being in that meeting based on the conversation with the Department of Mental Health. And so here we are still today. We are not 100% confident what the hole is over at the Department of Mental Health. And so we're going to continue to dig into that to find that out. But as far as the conversation on the tax cut, we're still having those conversations with the Senate if we're going to pursue that or if we're going to pass that or not. But for the time being, we have to, no pun intended, we got to put out the fire that's going right now at the Department of Mental Health. And so there's a lot of other issues you may ask me about today we haven't had the capacity to dig into, because we've been trying to figure out what in the world is going on at the Department of Mental Health.
Along the Forestry service, the pro tem just a little bit ago was talking about what he thought personally would have been better was to issue a statewide burn ban. There were only probably a few counties in northwest Oklahoma that maybe would have fit under state statute to issue their own countywide ban. I wanted to ask you guys, obviously you got representation from all over the state. Is that something we can get done this session to be prepared for future fires?
So I was advocating every day of the fires for a statewide burn ban to be enacted. And the issue was As the statutes were laid out, there are 3 criteria that have to be met in order for a burn ban to be instituted by a county commissioner, and the counties did not meet those 3 thresholds. Now, some counties, my understanding, issued a burn ban anyway, even though they did not meet the statutory threshold, but they didn't. They did not meet the threshold. So the only way that a burn ban could have been issued was from the chief executive for the state of Oklahoma, who can waive those 3 and just call a burn ban anyway. You know, we knew, again, going back to preparation, you can roll the tape and look back on the floor of the House of Representatives on the day before the wildfires hit. Representative Dobrinsky stood up on the House floor and made a public announcement on the floor about the impending weather, the high winds, the low humidity, and what that would mean for potential wildfires. And so, you know, we knew that was coming. And look, a burn ban was not going to stop all of the fires. And, you know, I don't know how many investigations have been complete, if any, yet. But even if it stopped one, as Chairman May said, we had more fires than we had FTEs at the Forestry Department. And so even one fire that we could have stopped would have been tremendous with the amount of wind speeds and the low humidity that we experienced.
In the DOGE report, there is $157 million in health grant funding that's been identified to be sent back to the federal government. When asked about it, Governor Stitt said he didn't really know what that was. Do you have any idea where that's coming from, and do you have any concerns that that would be then sent to other states when it's needed here in Oklahoma?
I mean, that's concerning. The governor doesn't know where, I mean, because that report came from the executive branch. So when the report came out, we reached out to the governor's chief of staff to ask Mark Nettle to come speak to our caucus on Monday. Mark Nettle I met with me a couple months ago and also was publicized that he was going to lead the DOGE charge from the executive branch. And we were told that Mark was not the author of the DOGE report. He was just an advisor. I said, okay, well, who wrote the report? And we were told that it came from Nathan and Director Rose at OMES. And I said, okay, well, we would like for them to come speak to our caucus. And so we have invited Director Rose of OMES to come to our caucus on Monday to brief us for the first time on the DOGE report. And so look forward to hearing from him about what they're proposing in that report.
Obviously, you guys are ramping into the budget and everything, but with the governor's comments yesterday, is there any impact that you guys can see? Because obviously you all are going to be focusing on that, but you know, he wants certain stuff done, flat budgets and everything, but will the forestry comments impact future negotiations?
Well, look, so the executive branch has requested over $1 billion increase in state funds. Go to okhouse.gov, the budget transparency portal. So to be clear, the executive branch has asked for, I think, where's Chairman Caldwell?
1.3 was their first iteration of the executive branch ask.
1.3 billion initially, but north of $1 billion in ask has been the ask from the executive branch based on the agency requests. Our budget position is less than that, but we're going to continue to go through that. And Chairman Caldwell and his counterpart in the Senate, their negotiations are going well.
But will there be bad blood or like any hard times with the comments from yesterday when it goes to negotiations?
Look, we're all professionals. At the end of the day, I didn't want to do this press. I'm used to having a press availability sitting around a conference table by myself talking to my friends in the press. But in light of the comments yesterday, I thought it was appropriate to bring some of my colleagues as well. And so, you know, we're simply responding to what was put out yesterday from the executive branch. And again, what we're hearing from our constituents, what's being said about the fire service in general. And look, those folks risked their lives. And Saturday morning, the day after the fires ravaged through part of my district, I was driving around Manford, and I pulled into the fire department. I saw the chief and some of his crew that were there. I just went up to shake their hands and thank them, and just seeing the exhaustion on their faces, because those gentlemen, they didn't sleep the night before. Not only were they risking their lives, I mean, they were staying up all night. And many of them, the volunteers, I mean, they were missing their work, their day jobs, so they could be out there saving other people's lives. And so we're going to stand with our firefighters.
Mr. Speaker, what's the next step on the mental health situation? Sure, it'll come up Tuesday at your breakfast with the governor and the pro tem, but what's the next step? Are you moving legislation forward that would deal with the bifurcated nature of Medicaid funding in the state? Are you having further meetings? Does there need to be a committee hearing where Commissioner Friesen comes and lays this out publicly? Like, what should we expect in the next week or two?
So We've had a lot of conversations to ask that very question, how do we land this plane? And I do believe it would be appropriate to have a public hearing with the Department of Mental Health, with the Commissioner, to ask this out in a public setting, to figure out what happened. Because at the end of the day, as I said, we don't know exactly what's going on, but I think the public needs to be engaged in this process. When the public found out about the cuts, particularly in the Tulsa area, I mean, you saw a lot of that conversation that happened over the course of the past weekend. But we've got to continue to dig into this, and it's too important not to.
Mr. Speaker, you had Superintendent Walters meet with your caucus on Monday to talk about the social studies standards. I'm curious what your takeaways were from that meeting, and if you have any greater clarity now on what your members are comfortable doing with those standards.
Yeah, I appreciate the state superintendent coming. It was the first time he's come to one of our caucus meetings, and it was good to hear from him on the standards and the process and you know, the exact verbiage of the standards themselves. As I said earlier this week in an interview, you know, there's a lot that's not in the standards that has been portrayed as in the standards, and but I think at this time our caucus, we still haven't had time to dig into that, because frankly, again, this situation of the Department of Mental Health has kind of postponed us being able to dig into that situation. Well, if we are going to act on it, it's my understanding we have 30 legislative days until May 1st, and so we'll communicate where we stand at a later date on that.
Real quick, so the cuts go along with what President Trump has obviously been trying to put forth, looking for waste, efficiency, all that. You guys are Republican representatives. Republican constituents would say these cuts are in line with what President Trump wants. Governor Stitt's falling in line with that as well. Why are we upset about this? This is looking for waste. This is looking for going for efficiency.
I'm so glad you asked that question, because we are raising concerns today from a conservative standpoint. And now I do also want to say a difference. Elon Musk is working in concert with congressional Republicans, having meetings often in committees with Senate Republicans, House Republicans. We still have not met with the author of the House DOJ report. Just found out earlier this week who authored it. And so we're going to meet next week for the first time to hear about it. Now, from a conservative standpoint, is it conservative to spend $200 an hour on a contract nurse when you can instead employ that nurse for $65 an hour? That's not conservative. And so the concerns that we're having are from a conservative standpoint. Is it conservative to reduce, to not fill positions with the Forestry Service? And so you save money in the short run, but in the long run, you end up spending more money when you're talking about disaster and cleanup and restoration. Is it conservative to save $6 a day for a second meal for the elderly, when in the long run, you're going to spend hundreds of dollars a day for that same person in a nursing home? So what we're saying is we do need to have government efficiency, and that's what we're standing for.
On the topic of Governor Stitt's executive order this week, among many things that happened regarding religious freedom in schools and the upcoming Supreme Court decision, you know, I wonder if you think that the governor is getting maybe ahead of that conversation, but putting out the executive order and mandating state agencies to kind of review their policies and bylaws as to how they may or may not discriminate against religion. Just your thoughts on that dynamic? Yeah,
I heard about the executive order after it came out, and so I read through it. And look, we support religious freedom. I'm not sure what you know, what was the genesis of that executive order, but we support religious freedom.
Mr. Floor Leader, I was wondering if I might ask you a little bit about the mental health situation. I know you've been an advocate throughout your life, and also know that you know, in particular, a little bit about the CCBHC model. So I'm curious what your take is on how things are going. You can talk about specific remarks people have made or not, but what is your perspective?
I mean, I watched the governor's press conference yesterday and heard some of the comments that he made. You know, some of it, you know, up my way with one of the agencies, and so if you're asking my personal opinion, I would agree that when they got into specific salaries, I mean, I don't think he's wrong with that. Now, with what's happening within the department, as the speaker mentioned, you know, we don't really know that. That's why it's important that we do have those conversations. They have, like the speaker mentioned, have met with the director, and so I would assume that I would say that I would think that in the near future, hopefully we will have a public forum where we can get those answers. We're kind of learning in real time as everybody else is. So that's where I'm at right there, Travis.
Appreciate you.
Yeah, and something I'll add to that is, look, if you roll back to last week's press availability, I touched on this a little bit, and I talked about the fact that if there are bad contracts, we should absolutely look at and revise or terminate any bad contracts. But a distinction that I would say is you don't retroactively change contracts. If you're in a bad contract, you're in a bad contract, you signed it. You don't make it any better by losing a lawsuit and backdating a bad contract. What you do is you exit the contract per the terms of the contract, and then you renegotiate moving forward. And so, the director asked us in my conference room, how we move forward, and that was my suggestion is, hey, if there are bad contracts, let's revise them, but work collaboratively with the legislature so that we can work together to say, hey, look, we see here's where some bad contracts are. Here's how we're going to revise this program moving forward in the Department of Mental Health. And frankly, that's what I'm hearing from the stakeholders in the mental health community as well, is they would love to be a part of that conversation. And so what I said in that room, and if I've said it once, I've said it 1,000 times, many of my colleagues have heard me say this many times. In the legislature, we do not mind bad news. What we don't like is surprises. And we were surprised and caught off guard by the news out of the Department of Mental Health, and we found out after the fact, and frankly, that's unacceptable when we're the legislative branch tasked with overseeing agency budgets.
The governor did express confidence in Director Friesen yesterday, Commissioner Friesen. Do you share that confidence?
Look, the governor has a purview of hiring and who is the director of the Department of Mental Health. We're going to continue to work with the director and do what's best for Oklahomans.
Is that, when you talk about a public forum, are you talking about maybe the law committee? Do we know what the timeline is on that, or do you think it needs to be something before that is going to be completed?
I don't know yet, but I do think it's important, and it's something we've been talking about. I do think whether it should be a committee of the legislature asking questions, and you do it in a public forum. There's no he said, she said. Everybody can roll the tape and see what was said, and also to find out the facts of the case of what's going on. We did ask Loft. We also asked the state auditor to look into it. I know some of our members have been in communication with the state auditor to find out, anything that she can find, and so we're going to continue to be in communication with all stakeholders to get to the bottom of this.
Is there a possibility of JCAP next week or the week after that, maybe on Forestry or anything?
There's always a possibility. Mr. Chairman, anything you would like to add?
No, Mr. Speaker, I think that, there is a possibility of that. I know we're currently in conversations with my counterpart in the Senate and see if we can bring something, especially in regards to this forestry issue, bring it to a quick conclusion. So I think that's something that's definitely on the table.
It's time for one more, guys.
I have a question.
Yeah.
We asked Senator Paxton about the concerns about duplicity with DOJ, duplicate efforts in trying to make things more efficient, which would be less efficient, right? And he said that he had some concerns kind of specifically around how DOJ is going about reviewing the economics and the efficiency as far as spending and waste and stuff like that in agencies. One of the things that he said is long before DOJ, there was Loft, which came up, within the past 5 years, 6 years. Do you see the duplicity there in Loft, or is DOJ, is the governor's DOJ, as far as you can tell? I know you haven't had that discussion yet with the authors of the report, but are they doing the same thing as Loft? Do we need it?
Look, we're all ears. If there's members of the public who have ideas on how to make government better, we're going to be all ears, whatever channel that comes through. If that comes through somebody knocking on our door here at the state capitol, if that comes at a town hall back home, if that comes in a message through our Oklahoma Doge portal, if that goes through the governor's Doge portal, we're all ears on ways to make government efficient, make things better in the state of Oklahoma. And look, I just want to say it is an honor to serve as the Speaker of the House and to serve alongside my colleagues that are behind me, and many of them standing over there behind the cameras as well. We have some great public servants here who really, the reason we're standing up today is because we want to stand up for what's right for the people of Oklahoma. And at the end of the day, that's what it's about. That's what we're here to do. Look, we all serve 40,000 people in the House of Representatives, and when we all drive back to our districts as we wrap up here, we're going to be at diners in our districts this evening. We're going to be at the grocery store over the weekend. We're going to be at church on Sunday morning, and we're going to hear from our constituents what they think about these issues. That's what we heard last weekend, too, how they were upset about comments about the Forestry Service. And we respond to the people of Oklahoma, and that's what we do in the House of Representatives. And so thank you all for joining us today. Appreciate it.
Thank you so much.